workers and
mangunguling, there's always a health hazard because first of all there's smoke, and smoke is hazard itself. It triggers illnesses like asthmatic bronchitis, and it irritates our mucosa in the respiratory system, which may also result to the asthma, TB, and other communicable diseases. And if not treated early, it may cause complications like pneumonia and malnutrition. Regarding the, because of they use their muscles in carrying heavy objects, heavy materials for the uling. Of course, their muscles will be used, and it will cause aches and pains, and also and if ever they they have this uling, no, they may not have proper sanitation. Diba? They should wash their hands properly before they eat, or else they will have this worm, intestinal worms, and this may cause this will affect their health.
We also found out, Mom, that some of them are also they have their cigarettes. They used to smoke while they were selling their uling.
That will compound the risk. Smoking itself, even you are not manguuling, that cause cancer, that cause cardiovascular diseases, and it aggravates other diseases because smoking is, if ever one manguuling is smoking and the other is not, second-hand smoking is also very dangerous. So it should be a policy, or within themselves, nobody will smoke. If ever there is smoke, it should not be at the work site.
One of them, they believe that drinking tobacco can lessen the effects of the dust coming from uling. Is that you just asked, Mom, if how effective it works, Mom.
Tobacco goes to the intestine, the stomach and intestine, and uling, the smoke, goes to the respiratory tract. And also there are cases na this uling will have dust. It will be pulverized, and it will be a dust-like, no? This dugmok, no? And it is also possible that it goes to the respiratory tract. It will be inhaled, and the lungs, the bronchos will be affected. So another illness.
What can you recommend to them?
What I recommend is they should not smoke with other workers, and if ever, they should use mask. Spending something for the mask is prevention, but it doesn't prevent that much, no. But it will in a small way. And also, if ever they are feeling sick or whatever illness they have, they should consult our doctors. If they have their own private doctors, they go there. And if they do not have, they can come to the City Health Office, where we offer free services and free medicines to the indigents. And be careful, kaya yung mga muscles, they should learn how to, maybe one of these days, we can invite physical therapist or a doctor who is specializing in kinetics, in physical therapy or physiotherapist, and tell them how to function, how to do their movements so that they will not aggravate the muscle pains or any joint affection, illness. Kasi there are mga yung mga we have mga pagkuha ng halimbawa, pagkuha ng isang bagay, you should not bend. You should bend your knee before you get it so that you will not be affected. Your muscle will not be affected or your spine. So I think that is better yung mga uling will have an organization or association so that they can have this information drive about their health. We are always open and to give them this one, to coordinate with them. And it is good that I was, during the time you came telling me about this manguuling, it's one of its kind. And it is good that you are focusing this one, you're focusing your papers on this one, and parang neglected. They are a neglected part of the society. And I congratulate you for having this topic, But one word of caution sa mga uling, they should not go to, sometimes uling gets saving for the family, for the gas, for the kerosene, for the electric. Pero we should also be cautious, the government also be cautious. Baka naman nagkakaingin na sila. And it will affect our natural resources. So,